My name is Sarah Evans. I am a senior student at Northern Kentucky University. This is my virtual poster presentation for my R&BSN Leadership Change project. The project I chose was to develop a hypoglycemia simulation for pregnant inpatients. Simulations have been shown to increase teamwork and communication in the healthcare field. Simulations have been used at Good Samaritan Hospital in labor and delivery since March 2009 and special care OB since 2010. The multidisciplinary role-play simulations are mandatory for the nursing, residents, and physician staff. The simulations take place in the clinical setting and include other members of the healthcare team when needed for the situation. There are 2 simulations per month on the labor and delivery unit and 9 per year on the special care OB unit. TraHealth is the member of the Premier Healthcare Informatics and Insurance Management System. The Premier Group is a part of their perinatal safety initiative partnered with the Institute for Healthcare Improvement to develop processes to improve outcomes for inpatient maternity patients. The second phase of this program is to improve communication, safety, and teamwork by the use of simulations. A need for an additional simulation was identified by the staff of the Special Care OB Unit and the maternity educator Sandy Warner, due to the high-risk situation of hypoglycemia pregnant inpatients. First step in this project was an in-depth review of literature, policy and procedures, and standard format for maternity TraHealth simulations. A scenario was developed to meet the needs of the staff. This was reviewed by Sandy Warner, the maternity educator. The simulation was tested by staff on October 15, 2012. The staff was oriented to simulation goals of improving teamwork, situational awareness, communication, and possible process improvement. Resident and physician staff was notified of simulation. The roles of patient, primary nurse, charge nurse, and helper nurses were assigned to the nursing staff. Roles were identified by name badges. The prepared script was shared with the patient and primary nurse while the other staff was asked to leave the room. All the necessary simulation equipment was set up to make a realistic situation. The simulation was videotaped. The simulation was performed with the assistance of vital sign flashcards. A debrief was completed at the end of the simulation that included a review of the videotape. During the debrief, the staff spoke about what was done well and what could have been improved and any aha moments experienced. Evaluations completed by all participants after the debrief. All the comments were positive. The simulation was shared with the Premier Group representative. She was very impressed with the simulation and will share it with other Premier hospitals. The simulation was also shared with Bethesda North Hospital maternity educator. The remaining slides will show the handouts associated with my poster presentation. The handouts include the abstract, reference page, and all the materials used in the simulation. Thank you to Sandy Warner, the maternity educator at Good Samaritan Hospital, and Pam Fletcher, my Northern Kentucky University professor for the Senior Leadership Practicum, for all their help with this project.